In this video, we're going to cover 8 different common types of thumb pain, each with distinct causes, symptoms, methods of diagnosis, and treatments. So the first common cause of thumb pain is osteoarthritis, which is also known as degenerative joint disease. Now this happens because of wear and tear to the cartilage at the base of the thumb joint, and the condition is typically more common as you get older, and it's more common in people who are 40 or older. People with osteoarthritis often experience pain, swelling, stiffness, and a decreased range of motion in their thumb. The pain typically worsens with activities that involve gripping or pinching. Now, to diagnose osteoarthritis, a health provider will perform a physical examination by looking at the thumb and putting it through a range of movements, and they might order x-rays to assess the extent of joint damage. Now, treatment options for osteoarthritis include pain relief with non-steroidal anti-inflammatory drugs, so things like ibuprofen, wearing thumb splints to support the joint, engaging in physical therapy, and if these don't work, to help relieve the pain, there is the option of receiving corticosteroid injections, and in very severe cases, undergoing surgery, but this is a last resort option and it isn't always suitable. Another condition that can cause thumb pain is DeQuervain's tenosynovitis, which is known also as radial styloid tenosynovitis. Now this condition is caused by overuse or repetitive movements of the wrist and the thumb, which leads to inflammation of the tendons at the base of the thumb. Now symptoms include pain and swelling near the base of the thumb, difficulty moving the thumb and wrist, and a catching or snapping sensation during thumb movement. Diagnosis typically involves a physical examination and something called the Finkelstein test, which assesses pain on thumb movement. Now in this test, you bend your thumb across the palm of your hand and you bend your fingers down over the thumb. You then bend your wrist towards your little finger. Now if this causes pain on the thumb side of the wrist, you likely have DeQuervain tenosynovitis. Now sometimes an ultrasound might be used to get a better look. Now, treatment often includes rest, applying ice, taking non-steroidal anti-inflammatory drugs, and wearing a thumb splint, as well as getting corticosteroid injections and physical therapy. The next cause of thumb pain is a condition called trigger thumb or stenosing tenosynovitis. Now, this condition results from inflammation and thickening of the tendons that flex the thumb, often due to repetitive gripping. Now, people with trigger thumb often experience pain at the base of the thumb, as well as a clicking or popping sensation when they're moving the thumb, and sometimes the thumb gets stuck in a bent position. Now, diagnosis is again usually based on a physical examination and feeling the tendon sheath. Again, treatment involves splinting, taking non-steroidal anti-inflammatory drugs, getting corticosteroid injections, and in some cases, surgery to release the tendon sheath. Now, you're probably seeing a pattern here that the general treatment for thumb pain is very similar, no matter what the cause. Now, the fourth reason for thumb pain is something called skier's thumb, also known as gamekeeper's thumb. Now, this condition is caused by an acute injury or chronic stress, leading to a tear of the ulnar collateral ligament at the base of the thumb. Now, this often happens from a fall on an outstretched hand. Symptoms include pain, swelling, and instability at the base of the thumb, making it difficult to grasp objects. Now, to diagnose skier's thumb, a physical examination and stress x-rays are often performed to assess ligament integrity, and sometimes an MRI scan is needed. Treatment for partial tears includes wearing a thumb splint or cast, whilst complete tears often require surgery followed by physical therapy. Now, a very common condition that also causes thumb pain is something called carpal tunnel syndrome. Now, this condition happens when the nerve called the median nerve is compressed as it passes through the carpal tunnel in the wrist. Symptoms include thumb pain along with numbness, tingling, and weakness in the thumb and first 3 fingers, often getting worse at night. Now, diagnosis involves a physical examination and nerve conduction studies. Treatment options include wearing wrist splints, taking NSAIDs, getting corticosteroid injections, and in severe cases, having surgery to release the carpal tunnel. Gout is another condition that can lead to thumb pain, and this is characterized by the buildup of uric acid crystals in the joint, leading to sudden and severe pain, swelling, redness, and warmth in the affected area. Now, diagnosis of gout typically involves a physical examination, blood tests to measure uric acid levels, and joint fluid analysis. Treatment includes medications to reduce the pain and inflammation, lifestyle changes to manage uric acid levels, so for example reducing your red meat and alcohol consumption, and in some cases medications to prevent future attacks. Now, a thumb sprain can also cause significant pain. Now, this injury usually occurs when the ligaments that connect the bones in the thumb are stretched or torn, usually due to a sudden force or twisting motion, so for example, a fall. Symptoms of a sprained thumb include pain, swelling, bruising, and difficulty moving the thumb. And diagnosis again involves a physical examination and sometimes imaging tests like X-rays to rule out fractures. Treatment typically includes rest, applying ice compression, elevation, and using a splint or brace to support the thumb whilst it heals. Now, severe sprains might need physical therapy to restore the strength and range of motion in your thumb, and in rare cases, surgery might be needed to repair torn ligaments. Finally, a broken thumb or thumb fracture is a more serious injury that involves a break in one or more of the bones in the thumb. This can result from a fall, a direct blow, or severe twisting motion. Now, symptoms of broken thumb include intense pain, swelling, bruising, as well as visible deformity and inability to move the thumb. Now, to diagnose a thumb fracture, a health provider will typically perform a physical exam, order X-rays to determine the extent and location of the break. Treatment for a broken thumb involves immobilization by placing the thumb in a splint or cast to allow the bone to heal properly, but severe fractures might need surgery to realign and stabilize the bones using pins, screws, or plates. After immobilization, you're going to need physical therapy to restore full function and range of motion as well as strength to the thumb.